Well, we are certainly in the middle of an evolving pandemic, so I want to bring in an expert. Dr. David Winter with Baylor Scott White Health joins me live. You've been all over the place, Dr. Winter. What can you tell us about where we are now locally as it relates to COVID-19?
Well, Sonia, I can tell you last week we predicted a huge increase in cases. We saw this takeoff beginning. As of Monday and then as of yesterday, it's starting, it looks like maybe to peak. So we're cautiously optimistic. Maybe we are getting to that flattening of the curve people talk about. Cases aren't exploding like we worried. We still have plenty of hospital beds, plenty of protection equipment, plenty of doctors and nurses. So cautiously optimistic is the word.
And do you think that we're faring relatively well as a result of aggressive action early on and also social distancing?
I personally believe that indeed, because this is an extremely contagious virus. When one person gets it, at least 2 or 3 people around that person tends to get it. So we see it explode in all around the world right now. And by distancing, physically distancing by 6 feet, and by careful hand washing, hand disinfecting, I think that's the chief reason we're seeing these potential declines, certainly in New York City and hopefully in Dallas County and North Texas.
You know, I think then the next question people ask is, well, when we all sort of re-emerge, what happens then? I mean, we've seen Dr. Fauci say no more handshaking as a society. That's blowing people's minds. But what do you think about just mingling in public? Is that going to look totally different from now on, or should it?
I think it will, Sonia. Here's the issue. This virus, the human race has never seen before. If you haven't experienced it, you are very susceptible to it. So folks that have had it, many folks, by the way, have it and didn't know that they have it. Those folks are immune for the most part, but everyone else is not. So if we socially distance, wash our hands very carefully, and it dies down in the community, but then comes back in, those who have antibodies built up will be immune. The rest of us will all be susceptible. So we can see another wave that's coming back. So I think the physical distancing is going to continue for a while. Handshakes, they've got to go away for the time being. Hugs, kisses. It's going to be a whole new world, Sonia.
Yeah, it certainly already is. I'm glad you mentioned the antibodies. What does antibody testing look like? And can you just explain that process a little bit more for people? I've gotten a ton of questions about that.
So the good thing about this virus, if there's any good things, is that it's not that deadly. Now, we feel sorry for the folks who have suffered and those who've lost friends and family that have died. But in fact, 98% of people kill the virus. Now, you kill the virus by building up antibodies. Your own immune system builds up these antibodies which attack it and then kill it. Those antibodies stay around. That's why these childhood viral illnesses that many of us had or got vaccinated against, we don't get those again. So those folks should be immune, and the antibody testing that will tell us who is and who is not. So we're excited that antibody testing is on the way. I hear maybe 3-4 weeks. We don't know when we're going to get it. The machines are here, but the reagents, the way you run the machines, are not available yet. But that'll help us a lot to figure out where the pockets of infection are, where we need to continue to distance ourselves, and where we might be a little bit more lax about that in certain situations.
And a lot of folks now are also asking about this convalescent plasma. So basically, as far as I understand, mild cases, you know, patients who've had COVID-19, 4 to 8 weeks is what I've heard from, you know, the end of their illness is when they might be able to, you know, offer their plasma to other folks. Is that sort of about the timeline that's still accurate?
Yeah, the timeline, we're still trying to figure that out exactly, but the plasma is a part of the blood without the red cells. So if you look at red blood cells and you take that away, then there's a clear part of the blood that's called plasma. That's where the antibodies are contained. So those antibodies, we think, and this has worked in other cases, if you take the antibodies from a person who's had the virus, build up the antibodies and give those to someone who has the disease, that may help them to survive it. So we're thinking this for the very, very sick folks in the intensive care units in our hospitals. This might be a solution. Testing for that is undergoing right now.
Dr. David Winter, that liquid gold. I'll be curious to see what happens with that and really this whole situation. Thank you again so much. I'll look forward to talking to you again next Friday.
Thank you, Sonia. Stay safe.
Thank you. You as well.